Plus it's Friday, huh? It counts for something.
I know. Everyone got their everything on all the electricity working? Okay. Thank you all for being here. I'm introducing myself, Dr. Marty Fenstersheib, and I'm the health officer for Santa Clara County. And today I want to report to you that we've learned of 2 flu-related deaths that occurred in Santa Clara County. And both were men. Both happened to be 58 years of age. They were not related. 58 when they died. Both were homeless gentlemen. I don't have, I can't give you all their medical history, but they did have some underlying medical conditions. But the cause of death was definitely related to them being infected with influenza. So they were both medical examiner cases. And we worked with the medical examiner, Dr. Michelle Jordan, and so she confirmed those deaths. One of the 2 died on January 11th and the other on the 13th. So that was a little bit, it's been a little bit of time that's passed, but that's because the medical examiner in their workup takes a little bit of time before they confirm everything they need to. So they may, these may not have been as timely as we usually get our regular reports. These are, again, under 65, so these fall in the category of those that are reported to the state of California. And we talked to the state today, and they are reporting today, in fact, in their flu report, that there were, or have been 14 deaths so far in California, now with R2 and 2 in the Bay Area region, which are R2 deaths. There hadn't been any in the Bay Area region previously.
So the 14 includes the 2?
14 includes the 2. As far as
no other deaths in the Bay Area.
As far as I know, I mean, we're looking at the reports. My understanding is that there have been 14 deaths in California up until now, and these 2 are part of that, and they are the only 2 in the Bay Area. So last year at this time, there were some questions, but there was one resident that did die from influenza, a 56-year-old woman who happened not to be homeless, but that's what we saw all of last year. You know, in addition, as I had mentioned, I think last time, that in addition to those that have died that are under 65, also what is reportable are those cases that are considered severe flu, and those are defined by people that are in the hospital and have been in the ICU, intensive care. So they are going to be our sickest people, patients that are in hospital. We have had 3 since we last talked. So included in this report with the 2 deaths, there are in addition 3 severe cases of influenza. And again, I'm not going to go through any of their medical history other than to say that all of them were in local intensive care units and local hospitals. They have all since been discharged. They all have survived, and they've all been released from the hospital. So those are 3. Just to remind you again that we don't report every single case of flu. We do look at flu as more as a trend. And in that regard, in talking to the state today, their data, which we agree with, is that there is still a trending upward in all of our parameters. So we haven't peaked yet. We really won't know if we peaked until we can kind of look in hindsight to see when things started to drop. But the state is reporting today that all the trends are still upward. So people coming into hospitals, people with influenza-like illnesses, and again, all of these cases of reported severe cases and the deaths. So that we have not peaked in California at this point. So today, because we have had, again, these 2 deaths in homeless individuals, I just want to mention that I'm going to introduce Dr. Sara Doorley, and she's the medical director of the Valley Homeless Healthcare Program. She's going to be discussing a little bit about the homeless program and all the wonderful work that they've done to outreach to homeless. So because I know you'll have questions about what information has been provided and what we've done as far as helping to vaccinate that population. I still though, again, maybe I'm a broken record, but I still want to repeat the message about influenza. As I mentioned, it's still trending upwards, so that there is still time, still reason to get flu vaccine. check with your local health provider. We know that there have been some spot shortages at the retail pharmacies, but my understanding is that they have vaccine. So if you have not been vaccinated, please get vaccinated. And then in addition to that, again, the same thing, the same routine. Please wash your hands. We tend to always touch things and then touch our face, and this is how flu can be spread. If you're sick, please don't go to work. If you have kids that are sick with flu-like illness, please don't send them to school. And again, if you are someone or know someone that may have flu and is even at particular high risk, an elderly or someone with a chronic illness, there are antiviral medications that work very well, but they need to be given best within the first 48 hours. So there are antiviral flu medications that can be used for those that have been exposed or who are exhibiting early symptoms of flu. Okay, so I just want to introduce Dr.
Marty, as long as you're still staying in front of the microphone.
I'll come back.
Okay.
I want to give Dr. Doorley a time to really present some of the information on the homeless program, because I know you'll have questions on that too. So Dr. Doorley, where are you? There you are. Again, the medical director for the homeless program in Santa Clara County. I also want to introduce, I just want to recognize Dr. Michelle Jordan, who is the medical examiner coroner that will be involved in these cases. So she's in the office. Dr. Jordan.
So on any given night in Santa Clara County, there are approximately 7,000 homeless individuals. We know that these individuals are vulnerable. They're not only at increased risk for getting the flu, but increased risk for getting sicker from the flu. The Valley Homeless Healthcare Program and Santa Clara Valley Medical Center are dedicated and committed to serving this population of individuals. We have over 10 different clinical sites spanning a large geographical area, starting up north in Palo Alto and covering all the way down south to Gilroy and Morgan Hill. We also have a mobile medical unit and an outreach team that literally hits the streets, going out on a weekly basis, trying to find those individuals that are outside of care that haven't been able to access one of our standing clinical sites. In light of the recent death of these two individuals that were homeless of the influenza, we as a program have really augmented our flu vaccination services. This past week, we held 2 additional flu vaccine clinics for all homeless individuals to come in and get vaccinated. We also are continuing to offer our flu vaccination services to all of our patients that walk through any of our standing clinic sites. We are increasing our education to both our patients and to providers. And again, we know that housing affects health, that Santa Clara County as a community has really committed to housing these vulnerable individuals through the Housing 1000 program. The county is committed to housing 1,000 of their most vulnerable homeless patients over the next few years. So through the Valley Homeless Healthcare Program, in collaboration with the Department of Public Health and through the Housing 1000 program, we are really continuing to work with this vulnerable patient population and change in health. And also, if I could just introduce Janet Cole, she's our assistant nurse manager, and has been really vital and important in helping to augment our flu vaccine.
Do we know if these 2 people died as a result of being on the street? Of being on the street, to one of you? Can you step?
We have the medical examiner here who actually had those 2 cases. And,
had these people been living on the street? Did we know that, or?
I don't really know much more than they were homeless. They weren't living in they didn't have housing. They don't have a residence. Neither of them have a residence, so that they were. And as was said, this population is much more vulnerable. Their life expectancy is much less than the rest of us. They usually have other chronic illnesses, and so in light of all of that, this program has been outreaching them and vaccines and making vaccines available to them. So we want to prevent any more. Flu is preventable. We don't want to see any more deaths in any of the population, especially in this very vulnerable population of homeless in Santa Clara.
So we've had 3 deaths in the Bay Area, and they all happen to be here in Santa Clara County. What would you attribute that to? It seems kind of.
Well, we're the largest county here, so we sometimes see a lot more of everything in Santa Clara County. And as mentioned, we have a very large population of homeless. So again, there's a lot of flu, and as I said, and the state reminded me to say, that these are just trends. It's probably very underreported. the deaths and the severe cases are on point. I mean, those are reported to us. But as far as all the cases of flu, it's probably underreported. There's probably a lot more than we actually expect or have seen. So that's why we want to make sure that people realize that it's still there. It could get worse before it gets better. We know we've we've had a conference call with all the hospitals on the phone, and every one of them in our county has been seeing increased numbers of people coming into the emergency department. So they are also increasing their services and working to making sure they see everyone who's visiting. Okay, other questions for myself or Dr. Doorley?
To put perspective, the fact that there have the vaccinations that people have been getting, is that in the numbers putting a lid on things, and is homeless cases or a reflection of what happens when you don't get that?
Well, that's a good question. I can reiterate again that this vaccine this year is a good match to what we're seeing. And lots of people have already been vaccinated, so I'm sure that there has been certainly benefit from the vaccines that have been given. Our concerns, again, are the numbers of people, especially at risk, that haven't been vaccinated. So it's a good match. It's good to get the vaccine. It seems to be well matched to what is circulating, what's making people sick. Remember also that there are a lot of other viruses floating around, and I always say this too. We know that the hospitals have also been reporting other things like RSV, which is respiratory syncytial virus, other cold viruses, adenovirus, rhinovirus. So there's other things that are making people sick. So all that's causing people to be ill is not necessarily flu. The flu is very preventable, and so we're still pushing the vaccine at this point. But we are concerned about getting the message out to make sure that people realize that it is trending up, and we did want you to be aware of these two latest deaths in a very vulnerable population. Okay, I think we're done, and I think we're good.